If you want to understand what people mean when they talk about socialized medicine, the United Kingdom's National Health Service, better known as the NHS, is probably the clearest example. The NHS represents what is often called the Beveridge Model of healthcare. The basic idea is simple. Healthcare is a public service. It is funded primarily through taxes, and care is provided based on medical need rather than a person's ability to pay. In everyday terms, the phrase most associated with the NHS is free at the point of use. That does not mean healthcare costs nothing. The cost was simply collected earlier through the tax system and pooled across society. When someone walks into an NHS hospital, they are not asked about deductibles, insurance networks, or whether they can afford the treatment. The system has already been funded. How the NHS began. The NHS was created in 1948, shortly after World War II. Its foundation came from the Beveridge Report, which proposed rebuilding British society around a stronger social safety net after years of war and economic hardship. The idea was straightforward. Healthcare should function like other public services. Just as a person does not prove their income before using a public road or entering a public school, they should not have to prove their ability to pay before receiving medical care. Before the NHS, Britain had a much more familiar patchwork system: charity hospitals, out-of-pocket payments, limited insurance programs, unequal access based on income. The NHS did not simply add another option. It replaced that fragmented approach with a national system designed around universal access. The government role, more than just paying the bills. This is where the NHS differs from Canada and Germany. In many healthcare discussions, people use the phrase government healthcare loosely, but in the NHS, the government role is much more direct. The government does not simply finance the system, it largely operates it. Most hospitals are NHS owned and operated. Many doctors, nurses, and healthcare workers are NHS employees. The NHS is one of the largest employers in the world. Family doctors, known as general practitioners or GPs, are somewhat different. Many operate as independent contractors, but they work through NHS contracts and serve as the entry point into the system. A typical patient experience looks something like this. You register with a local GP practice. The GP handles routine care, prescriptions, and referrals. If you need specialized treatment, you are referred into the hospital system. Emergency care is available through accident and emergency departments. How the money works. The NHS is primarily funded through general taxation. Most funding comes from sources such as income taxes, consumption taxes, other government revenues. National insurance contributions, which function somewhat like payroll taxes, provide additional funding. Patient charges exist for some services, such as certain prescriptions, dental care, or optical services, but these represent only a small portion of overall NHS funding. The government determines the overall NHS budget and sets national priorities. This creates one of the system's greatest strengths and one of its greatest challenges. With one major payer, the NHS has significant bargaining power. It can negotiate drug prices, establish national standards, and reduce administrative duplication. But because the government controls the budget, healthcare decisions become political decisions. More money for healthcare means less money available somewhere else. The trade-off: one system, limited resources. Like every healthcare system, the NHS faces the same basic reality. Medical needs are unlimited. Resources are not. An aging population, new medical treatments, staffing shortages, and the effects of the COVID-19 pandemic have placed enormous pressure on the system. The result has been growing concerns about waiting lists, particularly for non-emergency procedures. Supporters point to the security the NHS provides: no fear of a massive hospital bill, equal access regardless of income, strong bargaining power for controlling costs. Critics point to waiting times, budget pressures, bureaucracy, political influence over healthcare decisions. Both observations can be true. The NHS provides universal access, But like every system, it must decide how to balance demand against available resources. The British model in simple terms. The NHS combines universal healthcare coverage, tax-based funding, government ownership of many healthcare facilities, government employment of many healthcare workers, central planning and budgeting, limited private healthcare options alongside the public system. The defining feature is not simply that government pays. It is that government plays the primary role in both financing and delivering care. You will find a handy table in the accompanying text.